Good evening and thank you for keeping it TV 47. This is Body Garage with I, Sheila Chelangat. And of course, you know, here is where your health matters. On this episode, let's set the record straight on some of the myths that exist around dental health, as well as some of the conditions and the treatment plans that are available. And taking us through it is Dr. Peter Irungu. How are you, Dr.
Thank you, Sheila. How are you?
I am good.
Yes.
So let's begin, Dr. They normally say that, you know, oral health is the window to the general health of the body. Yes. And let's begin now with the mouth, the teeth. Yes. What is the teeth? Is it just what we see? And take us through it.
The mouth means the space bound by our lips on the front. It's bound by the cheeks on the sides. It's bound by the tongue on the floor. It's bound by what we call the palate on the roof. And back there, it may not be very much bound because it's an opening towards the throat. So if you take note, that's like a well-constructed house. So all the front three walls can be closed, but the rear wall cannot close completely. Why? Because your mouth is designed to operate in all manners. Like you can open your mouth and speak, you can close your mouth and swallow. And by that, I always tell people, I don't know how many people have ever tried swallowing with their mouth open.
It's not possible.
It's not possible.
Yes.
So we are bound by the lips from the outside. And it's good to let our viewers know that, because any injury, any disease, any condition affecting your lips, your cheeks, your tongue, you need to visit a professional dental surgeon. Don't lose your track and maybe visit another medical practitioner. They may not be aware what's going on. So it's good for people to know that a dental surgeon deals with the mouth, which starts from the lips. And once you get into the mouth, okay, the lips, the functions, people know them.
Yes.
Speaking, smiling, whistling, all that. And it's good to note that they are part of the mouth. Once you get inside, we call it the oral cavity. It has what we call the teeth. The teeth are bound by the jawbone, and we have two jawbones, the lower jawbone and the upper jawbone. The lower jawbone is called the mandible, and it is the only jawbone that is mobile or flexible. I know most people don't know that.
Yes.
The upper jawbone is called the maxilla, and it is fixed to your skull. So your upper jaw never moves. I know most people now will try moving.
I'm trying to move it.
Only the lower jaw that moves. And it moves through a joint near the ear called the TMJ, temporomandibular joint. That joint allows you to move your jaw open, close, sideways, chewing, all that. So it's only the lower jaw that moves. The upper jaw is fixed. Your teeth, when they are fixed onto your jaw, I'm trying to get into the deeper details. Half of your tooth, or more than half of your tooth, is sunk in your jawbone. The only part you see, which is what we call the crown part of the tooth, is only like 30%. So most people may not know that. Most people think the only part you see in your mouth is all we call the tooth. Deep inside your jaw, we have almost 70%, and that's what we call the root of the tooth. Your root is not visible because it is sunken in your bone or sunk in your bone, and then overlying it is the gum, which is usually the pink cover. Most people call it the gum. I'm mentioning all that because each and every part of that section I'm mentioning can get its own disease, and it has to be treated accordingly, not collectively. So your tooth is well covered, three-quarters of it by your gum, and what you see mostly is the crown part of the tooth.
Is the crown part of it.
Yes.
For now a kid or an adult, how many teeth should someone have? And then let's get also to the nitty-gritty of how white should they be, because that is one thing that really, you know, disturbs some people.
Wow, all right. Let's start with the numbers. A newborn child will be born without any tooth. Most children, not most, actually 99.999% of children are born without any tooth in their mouth, and that's normal. But inside their jaws, they'll be having 20 deciduous or milk teeth, which will erupt at different stages as the child grows. A few children, maybe the 0.0001% of children can be born with a single tooth in the mouth. And that is what most people refer to as a plastic tooth. It's not a plastic tooth per se, it's just a normal tooth that has erupted very early before the standard time.
So would it need to be removed?
Most of the times, yes, we professionals might advise removal, especially if it's affecting the child's suckling. And it's also injuring the mother's breast because it's a sharp thing. Children are born without teeth so that they are able even to suckle for the first 4-5 months, because that is the time they're able to suckle without any tooth interfering. So in case it comes in and there's trauma, you are advised to bring your child to a professional dental surgeon. We can remove the tooth, or we can wait for it to fall off on its own. But your child is normal, because initially, or some few years ago, people used to be told that your child is abnormal, your child is a bad omen, because they have some teeth when they're born. And with time, we've taught people that that child is normal. It just happened that their teeth erupted way earlier than they were supposed to. And it doesn't mean that your child has any abnormality.
Okay.
Your child will start erupting her teeth at around 4 months for the earliest growers, 6 months for the average growth age, and maybe 1 year for the delayed growers or the slow growers. Most of the children's teeth should be very white, and that's why they are called milk teeth, because they should be as white as milk.
Okay.
I think that is where the name milk tooth came in. But unfortunately, nowadays we are seeing a major problem whereby our children are getting affected way before they're born. Probably we are finding some developmental problems, dietary problems, water intake, whereby their parents, if they take borehole water, which is very high in what we call fluoride, it goes and affects even the baby teeth before they erupt. And you find that when your baby's teeth erupt, they're initially white for a few months, and then they start turning black and brown. And that is what we call enamel hypoplasia. So it's good to advise maybe young parents, ladies who are expectant, let's avoid drinking any water from the boreholes, any salty water. And by drinking, I mean even cooking, because that is the other myth that people get wrong. If you ask someone randomly about borehole water, they'll tell you it's not good for drinking.
Yes.
So then when you go to the kitchen, that is the same water they'll put in their tea, they'll put in their food.
Yeah.
And at the end of the day, it gets absorbed into the body. So we like teaching people that the problem is not the way you drink it or what you do. The problem is how it ends up in your body.
In your body.
So cooking, drinking, especially ladies, we should avoid that, because the fluoride in that water is so high. It goes in and gets absorbed by the young child. It goes into their tooth structure. And when the tooth erupts, it has what we call fluorosis. Fluorosis is the brown color that teeth change into, especially the second set of teeth, which we call permanent teeth. But nowadays, we are seeing that problem starting as early as the milk teeth, where young children are having their teeth breaking down completely, almost to a flat zero, because of the water that the parents took.
Okay. And before we get even to now fluorosis and some of these conditions, let's talk about brushing teeth for the young ones. Should young kids brush their teeth?
Okay. A newborn child all the way to 1 year, they have a free way of survival. Their mouth is well designed to survive without any interference. They're only taking milk for the first 6 months. And then after 6 months, they still have like 4 or 6 teeth. So that young child does not need a toothbrush. What they need is a soft, clean, white linen, maybe a piece of a cloth, and maybe the parent can soak it in clean water and rub the teeth of the child. That serves only to remove the milk particles that may be sticking on that tooth. When the child hits from 2-3 years, when they are starting to converse, you can talk with them. That is the time you can buy your child a baby toothbrush. Don't get a huge toothbrush like this. The child will hate it. So we have some pediatric brushes, very tiny. They go with edges. And that is the time you start teaching your child how to brush. In the malls and the supermarkets, we have some baby toothpastes, which are rated with the age. It's important sometimes to follow that age grouping, because it means the toothpastes are produced according to the fluoride levels. Most of the toothpastes are what we call fluoridated. Fluoridated means a little fluoride has been added, which is the opposite of what we've discussed.
Yes.
What we find in water is a lot of fluoride. The advantage of fluoride in toothpaste is that it is what we call topical. Topical means like you're applying it on the tooth. And when you apply it on the tooth, anywhere there is some slight damage, that fluoride will go and repair that tooth topically on the surface. So that one does not get absorbed. So it's good when you're buying your child's toothpaste, you look at the age grouping so that you don't get one with so much fluoride, because most children will tend to swallow most of that
toothpaste.
So now again, when it's swallowed, you remember we've talked about swallowing and ingesting fluoride. So it's good to use the right age. Put a small piece, again, don't put the whole tube on the toothbrush. Yeah, we always advise what we call a pea-sized. Pea-size is like a pea, a very small granule. Yeah? Let the child play around with it. Even if they swallow, that's okay. The first steps, train your child to brush. Don't give them the toothbrush to go and brush. Let them open their mouth. Do it for them for like 1 year. Once you do it, you can leave them to play with the brush, but make sure the next time, brush them, leave them. And with that, your child will grow with that habit of toothbrushing.
And you're saying it is about growing with that habit of brushing your teeth. But sometimes as an adult, perhaps you didn't get the right training. And one myth that goes around is, the harder you brush, the cleaner that your teeth become. So how true is that? How should one then brush their teeth?
A toothbrush is just a tool to run around your teeth and detach whatever is attached to your teeth. What happens in your mouth, normally we have what we call dental plaque. Dental plaque is a combination of bacteria and some saliva and some food particles. And the three of them combine and line your tooth. And I like giving an example of whenever you wake up in the morning and you run your tongue on your teeth, you'll notice there is something slimy covering all your teeth. That is what we call plaque. Plaque is constantly present in your mouth. It is your toothbrush that removes the plaque before it forms again. And that is a cycle you have to keep fighting for the rest of your life. And that toothbrush, that is the function. It's not about how hard you brush. It's about applying it well on your tooth. No specific movement. People keep saying, I've been told to use circular, up and down. What matters is do it. Whether you do it circular, whether you do all the movements together. As I've said, the purpose of the brush is to run along your teeth and remove that soft plaque. Because failure to remove that soft plaque will lead to, one, the plaque starts hardening. The bacteria in that plaque will die off, and they'll harden and form what we call tartar. Tartar now becomes like a stone on your tooth, and that one now does not come off. Now, this one you're talking of way past 10 years and above, because below 10 years, it's hard for your body to allow that to happen. We have some defense mechanisms. But the more you brush, not harder, not softer, just running your brush around will ensure that the plaque is always at minimum. And that again explains the question of how many times should we brush?
Yes.
We should brush as many times as we can, as long as you are able to. Yes.
That's quite interesting. I would want you, Dr. to hold on to that thought. When we come back, you'd now give us more on, how many times a person should brush their teeth. And so we are up for our first commercial break. Do not go too far. Keep it TV 47. But first, take a look at some of the myths and facts we compiled on this episode.
Bleeding gums are normal. Bleeding gums during brushing or flossing is due to inflammation of the gums. Gums can be inflamed and begin to bleed due to excessive plaque buildup, onset of gingivitis, gum disease or other causes. Visit a dentist for examination. Visit a dentist for examination. Brushing hard cleans better. The harder you brush is the more trauma the tooth enamel and gum tissue endure. It can eventually lead to other problems such as gum recession. Brush gently for 2 minutes at least twice daily with a soft, bristled brush.
All right, welcome back. This is TV47 Body Garage with I, Sheila Chelangat, and on this episode we are talking everything about teeth. And just before the break, Doctor, we were talking about, how many times someone should brush, and there are people who brush after every meal.
Yes.
They brush. Is that okay?
That's okay.
And then how would you recommend the procedure for brushing? There are people who would brush, floss, and then use mouthwash. So what would you recommend?
Okay, let's start with the number of times. You can, as I said earlier, you can brush as many times as you can. But as you get busy in life, of course, you realize you don't have much time. So we always advise for adults, let's brush at least twice a day. In the morning after breakfast and at night before you sleep. In the morning, most people will interchange and brush before breakfast, and then they forget what was the purpose of brushing. We've agreed the brush will remove all the food particles, the plaque, and all. So whenever you sleep for 8 hours and more, you wake up with a lot of plaque in your mouth. And you'll find a good number of people will say, I cannot be able to take my breakfast without brushing.
Yes.
That is okay. You can take your brush your teeth well, take your breakfast, and brush again.
Okay.
Because if you don't brush again, it means you've left your home, you've left with the new food you've taken, the new plaque has gotten some new substrate. So by the end of the day, you'll have formed a lot of plaque, which should have been removed immediately after breakfast. Maybe something worth mentioning is that the bacteria we find in the mouth, they really love you feeding them.
Okay.
So the more you give them a lot of food to take and a lot of time to consume it, the more they might cause you more harm, the more they'll multiply. So any opportunity to reduce that plaque and number of bacteria in your mouth is always welcome. So at night, we advise you brush again before you sleep so that you remove all the plaque that has been forming the entire day, all the food particles that are hidden, so that as you sleep, you only have to get a new colony of bacteria which may not be aware of what is happening, and it's morning again and you've brushed again. And that is a cycle you'd like people to maintain. The same with children. You can brush them as many times as you can, as long as you're brushing them to remove the plaque. I think the other thing is about
the procedure.
The procedure. We've agreed any pattern can work, but ensure you brush all the teeth in your mouth. And this is for adults, whereby most people are very good at brushing the front teeth. But then when they go to the back, they only brush 1 or 2 teeth and they stop there. And they have 3 more teeth at the back.
At the back.
And what do they say? No, I'm not able to brush my back teeth. So the challenge is always, whenever you are brushing your back teeth, first of all, let me tell our viewers that your tooth has 3 surfaces to brush. Maybe we can use this tooth as a demo. Whereby your tooth has the outer surface, it has the inner surface, and it has the top surface to brush. So if you feel with your tongue, as we teach, it's good to run your tongue. The inner side next to the tongue is the inner surface. When you move your tongue on top, you will feel the surfaces that you chew with, and then you can loop over your tongue to the outside towards the cheek. That is the third surface. It's good for people to note that it's worth brushing all the surfaces. Some people will forget and only brush one side and then they are gone. And they forget there is another top part and there is an inner part. So anytime you're brushing all your teeth, including the back and the front teeth, let's remember the 3 surfaces. When you get to the back of your mouth, close your mouth. People get it wrong when they brush with their mouth wide open. And you find that the muscles at the side will always be tense. Once you open your mouth, your muscles will stretch and they reduce the space between your cheek and your tooth. And most people will say, my toothbrush is hurting me, so I cannot put it back there. So the trick is always bite your teeth together, close your mouth, and your brush will go up to the last molar, which is usually called the wisdom tooth. And whenever you brush like that, you'll make sure all the surfaces are clean. Then you move to the top surface, and then you move to the inner surface. The tongue does not need to be brushed. Let me say that. Because most people will run around the bathroom, they almost want to vomit because they're brushing up to their throat. And they think that brushing your tongue will take away bad breath and all. No. Any bad breath in your mouth should be identified by a dental surgeon, and it will never come from your tongue. So let's stop injuring our tongue. let's not hurt our tongue. And that's why most of the toothbrushes you may find will have two sides.
Yes.
There's one with the bristles, and then they'll market a softer side at the back for your tongue. What does that tell you? It tells you that the hard surface of the bristles should not be used to rub your tongue. Your tongue is soft. It's like a very soft material, so it doesn't need all this roughness. All toothbrushes are made of these plastic bristles, and they are of different tensions. There is the softest, which feels like feather. There is a medium, which is comfortable for all. There is a hard one, which can even prick you. And then there is an extra hard, which can even break a glass.
And who uses those extra hard ones?
I don't know. I think they're just there in the market. So it's only wise for people now to know, because I think they've just been provided for whoever will want. And most people will pick them thinking that they brush better. But those hard brush and extra hard will actually cause tooth wear. Most people who use that end up with what we call cervical abrasions, and their teeth will get sensitive. So let's stick to our medium toothbrush. How many minutes do we brush? At least only 5 minutes. As long as that's enough to cover all your 32 teeth and all the surfaces. And once you're done, probably you mentioned flossing. Flossing is good. It's only good for cleaning in between your teeth, where your toothbrush can not get in. I think I forgot to come with a floss, but I can use my toothbrush to illustrate how to floss. Because again, people get it wrong when flossing. When people get their floss in between their teeth, most people will do an out and in movement, like they're cutting something. And that is wrong, because the surfaces we want to clean when you're doing flossing is the surface running from the top to the bottom, between the gum and the top part of the tooth. So ideally, you're supposed to floss up and down.
Up and down.
Once the floss goes in, you start moving it again like you want to remove it, and down. That way, you're able to clean this surface, and you do it on two sides. You do it on the tooth at the back and the tooth at the front. Because some people are good at flossing, but all they do is put the floss in and then do that and remove it. And then you end up with cavities, and you're like, I've been flossing. How did this happen? Yes.
And what about mouthwash? Because the people who have now mouthwash to clean their gums?
I don't advocate for that. A mouthwash is an antiseptic. An antiseptic is a medicinal product. So mouthwashes are strictly for any oral condition that may warrant some antiseptic rinse, like sore throats, an injury to your tongue, maybe you bit on your lip. That time, a mouthwash is good. And it's good for people to stop misusing mouthwashes in the name of oral hygiene. Most of the time, the mouthwashes might end up actually reducing the normal flora in your mouth. And they might lead to maybe proliferation of even the bad bacteria. Because your mouth has a way it balances. We have what we call normal flora. The bacteria I was talking about. We have the normal flora found in your mouth, and then we have the pathologic. Pathologic means disease-causing bacteria that may crop in between. The normal flora is always good at maintaining the balance. It takes care of the pathologic ones. So sometimes when you keep using those antiseptic rinses, it means you're clearing everything, including the normal flora. And you might end up with some damages on your teeth, which might be avoided if you don't. So let's stick to mouthwash rinse only when we have an oral condition that requires some medication. So throat and wounds and such things. So let's not finish with that. Just brush, floss. Flossing should be done when you're free. Again, flossing is not a daily morning routine. It should be done maybe at night when you're relaxing, not in the morning, because you need to floss all your 32 teeth again. So those are actually like 64 surfaces. Because each tooth with its surface. So let's try to be flossing. It doesn't have to be daily. You can even do it once a week, twice a week. So people should not belabor on the flossing. Let's work more on our brushing and maybe even diet changer. Because most people will also be consuming a lot of chocolates, a whole box in the day. And they want your toothbrush to just sort that problem and you avoid cavities. That one may be an uphill task. Because the bacteria we are still talking about, I told you they love being fed. When you feed them with that soft sugar, we call it cariogenic diet. Cariogenic means it encourages the bacteria to grow and to start forming cavities on your tooth. Because it's made of what we call refined sugars. So the more you take the refined sugars, the more the bacteria have a field day on your tooth, because they don't have a struggle digesting that. If you give them sugarcane, they'll actually run away because they may not be able to break down that sugar. So most of them may not even survive. But when you give them sweets, biscuits, chocolates, and what have you, you've given them the best diet for them to proliferate. And you'll end up with cavities, whether you brush or not.
Or not.
Yes.
Okay, Dr. And I'm glad you've even gotten into the whole topic of tooth cavities.
Yes.
And so let's begin with kids. There's some kids who get cavities and say you've just been giving them a normal diet. What causes that? And is it just only sugar that is responsible for these cavities?
Yes, most likely sugar, most of the times, is the primary. We've called it karyogenic. Okay, we usually call them carbohydrates and all that, because that is what the bacteria survive on. But again, those sugars and refined sugars are the culprits. Children are prone to get cavities because of their tendency to love sweets unconditionally. You give them any time. At least an adult may be a bit, I don't want some more.
Yeah.
But a child can chew them the whole night. So children are prone to that. Secondly, baby teeth are not very well formed, or rather, they're not as hard as permanent teeth. Why? Because they're designed to last only like 10 years. But your permanent tooth is designed to last a lifetime.
Yes.
So the material content of your permanent tooth can withstand some of that barrage. But a baby tooth will decay at the slightest provocation from the bacteria. The question most people ask is, what is the connection between the sugar and the cavities?
The cavity, yeah.
A quick preview on that. Bacteria, bring in bacteria. Bring in the sugar, bring in a tooth. When the three mix in one pot, the bacteria will take up the sugar you've brought in. The bacteria is a living organism, so it has to excrete a byproduct. And the byproduct they produce after breaking down the sugar is acidic. It's actually an acid. And since they're all riding on your tooth, the acid is dropped on your tooth because that is their home. So anything in this world cannot survive an acidic attack.
Okay.
So your tooth will start wearing off. It will start what we call demineralizing. Demineralizing means the acid is taking away the hard part of the tooth and a small hole forms. When the small hole forms, the bacteria will move in and hide there. So now even if you brush a million times, you will never get to them. So the more now you feed them, the more they have a cocoon where they produce even tons of acid. And within a few months, the tooth breaks off and you find you have a hole.
And you have a hole.
It all started with a little drop of an acid. Yeah.
And why is it that once you get a cavity on one tooth, it sort of
Spreads.
automatically spreads to the other teeth?
No. It doesn't actually spread. That's a myth. What happens is that we say the child has 20 teeth, an adult has 32 standard. Your mouth is one hall. Let's call it a hall or one room where all the teeth are found. The bacteria in your mouth will be spread out on all the teeth. The saliva will be covering all the teeth. The food particles in your mouth will land anywhere. So at any time you are feeding those bacteria with a high diet of sugars, you will never restrict it to one side or one tooth. So you are chewing and swishing it and jumping all over. You are crushing with the right, left. So in essence, that tells you that all the teeth are under attack at the same time. So what differentiates the damage is that sometimes the tooth may decay faster on one area. But again, the other one is also decaying, but at a slower rate.
A slower rate.
But since the intake of the karyogenic diet will take a few years, like 5 years, that's enough time for all of them to be decaying consecutively, one after the other at different rates. And by the time you discover you have like 10 cavities and you think one moved to the other, no. It's always, all of them will form at the same time. But then they progress slowly. A tooth will break off while the others are still intact. After some while, the other one breaks off. And it doesn't mean that one was following the other.
Was following the other.
Yes.
So what is the immediate remedy for tooth cavities?
Immediate remedy, visit a professional dental surgeon. Nothing else. No toothpaste, no amount of mouthwash will ever clear a cavity once it forms. Actually, a cavity, in our medical terms, we refer to it as irreversible tooth damage. Irreversible means you can never reverse. You can only correct it.
Okay. As we talk about correcting, let us take now, the second commercial break. When we will be back now, we'll talk about some of these corrective measures that can be taken, as well as how now you can prevent other conditions of the, of dental health from, getting, infecting you or affecting you. Keep it TV 47. Thank you very much for keeping it Body Garage here on TV 47 on this episode as we delve into matters teeth. And Daktari, before the break, we were talking about cavities. So then how do you take care of cavities? Because always I hear it's about filling them. And once you have filled them, does it mean that now I've protected myself from future cavities?
All right. The first thing, okay, we always advise that you visit your dentist every 6 months. Why? Because as we've said, these cavities are hidden mostly in between your teeth. Secondly, most cavities will start as a very tiny hole. You may never see it, and it will progress. By the time your tooth breaks off, it's like 5 years down the line.
Okay.
So the reason we keep advising for people to visit us is because we are able to pinpoint, we are able to pick, we are able to see some color change on your tooth, and we can tell you something is going on here. Because when your tooth starts decaying, it changes to a black color, grayish black, and then as the cavity becomes bigger, it becomes darker and wider. So we are able to pick it early before the damage is much. And remember, maybe we can quickly talk about the progression of a cavity or a hole on a tooth. When a cavity starts, it's painless.
Yes.
Because it's only affecting the top part of your tooth. The top part of your tooth is called enamel. Deep inside the top part, we have what we call dentine. Dentine is the second layer, which is a bit sensitive. It has a few sensory, what we call sensory parts of the tooth. The top part, we said, has no, let's say, has no life. It's like a glass, actually. The second part has some sensory endings, and the third part is what we call the nerves. The nerves are now the real pain receptors. So whenever a cavity starts, you'll never notice because it's on the dead part.
Okay.
When it gets deeper after some months or some years, you start feeling a bit sensitive. When you take hot and cold, you feel that tooth is not good. If you ignore that, the cavity will end up in the pulp, and that is when pain starts. Even when you're seated, you start feeling pain. If it's your child, you notice your child is crying and they're telling you there's a tooth that's painful. So we advise that you come for the dental review so that we avoid this, we prevent these cavities from getting deeper and deeper. And by that we mean that once we detect a cavity on your tooth, the first thing we'll do is we'll do an X-ray to check how deep it is, and then we'll propose what we call a permanent filling or a filling. A filling is just a replacement of the damaged part.
Okay.
If a filling is well done, your tooth should be good to go without pain, without sensitivity. But again, don't continue with the soft cariogenic diet. Why? Because you'll again decay the next section next to the filling, and your tooth might end up all of it collapsing.
Okay.
If your tooth is painful, your dentist will talk about procedures like root canal treatment. In children, we call them pulpectomies. In broad term, we call them endodontic treatment. That means removing the nerves from that tooth, not removing the tooth. So I want people to remember that we've stopped extracting teeth. Dentists of nowadays don't extract teeth. If you find someone extracting your tooth, unless it's a professional surgeon who knows that the tooth is beyond repair, don't allow anyone to pluck out your good tooth as long as it is strong and stable. I'm saying that because people are losing teeth at a very high rate because they are visiting the wrong people, and a good tooth that would have been saved ends up being removed just by virtue of that person declaring it. This one is only worth removing. All your teeth are worth treatment no matter what. We hold on to your tooth up to the last minute because you'll never get another replacement, especially for permanent teeth. For babies, yes, there's some room to play around because they have another set of teeth that will come in. But again, don't let your young child, 4 years, 5 years, get their baby tooth removed because it's not yet time.
Okay.
Your child will not be able to chew until they're more than 12 years. Your child might lose that space where you've removed that tooth, and they'll end up with what we call crowding, whereby your child has their teeth will never be aligned because someone removed a baby tooth very early.
Very early.
Yes.
Okay, Daktari, let's move away from now the cavities. Let's go to gums. There's a myth that, bleeding gums are normal. So how true first is that? And what even causes the gums to bleed?
Wow, bleeding gums is abnormal. Bleeding gums is a disease. And maybe I can use this cast next to you. It's actually the one with our gums. You remember when it started, I talked about the gums covering 70% of your tooth.
Yes.
And the gums cover your jawbone. So deep inside I have a very good mouth here, which can always peel off my gum. And that's exactly how your gum should look like. Of course, you'll never peel it.
Yes.
But deep down, that is how it looks. Beneath your gum, we have the bone, and the bone covers most of the tooth. So anytime your gum is under any form of disease, it will manifest using signs of bleeding. It will manifest with bad breath. And what causes all this gum disease? Gum disease is caused by the accumulation of plaque. Remember, plaque, we said, is bacteria combined with saliva and then combined with food particles. When you have plaque on your teeth, mostly it will be soft and you may not see it. But when it hardens, you remember we said you'll have what we call tartar.
Yes.
Tartar now is colored. Mostly there'll be black, brown particles on your teeth. Most people will report that they've tried removing them, they cannot come out. Yes, tartar cannot come out unless you visit a dental surgeon to have them removed. So most of the time when you brush badly or poorly, you leave most of the plaque around your gum area. It will start building up into the tartar. The tartar will start pushing away your gum, and then you'll get what we call gingival recession. Your gum starts moving away from your tooth. And then you start exposing your tooth. Then you'll notice your tooth is becoming longer. By that time, mostly you may not have any bleeding. But at a certain degree, you'll notice now, anytime you brush, there's some bleeding coming from there. Why? Because the tartar has really pushed your gum too much. Your gum is fighting back. So a lot of blood supply is being pumped into your gum, trying to fight off the bacteria that is outside the gum. Yeah? And that is what leads to the gums bleeding. Anytime you touch them, they bleed. You end up actually with a condition we call spontaneous bleeding. Some people end up bleeding just when they wake up, they find, oh, my mouth is bleeding. Others will just hold their cheek and then they feel some taste in the mouth. When they go to check, there's some bleeding. That is called spontaneous bleeding. It is a sign of what we call severe periodontitis. Severe periodontitis is now the severest form of gum disease, whereby you are almost losing your teeth now. The end result of serious gum disease is that, as I've said, your gum will move away completely, your jawbone will move away completely, and then your teeth will start shaking. And that is what most people, kitambo, the years back, they used to think when you age, you lose your teeth. But we are teaching them that when you age, you should have all your teeth in your mouth, as long as you've been visiting a dental surgeon. So that we keep removing the plaques and the tartar and avoiding the gum swelling and receding and all. Yeah.
And can this gum disease bacteria spread to other parts of the body?
No, it can't. They are well localized into the mouth. Remember, we call them normal flora. Normal flora means they only survive in the oral cavity. The condition in the mouth is the only one that favors them. So anywhere else in the stomach and all, when people say swallowing and all, it may not affect you at all. But again, if they multiply in your mouth, they'll cause you enough damage to cause other harmful effects in your body.
In your body.
Yes.
Okay. Daktari, let's move now to another myth, which is that chewing gum works the same way as brushing.
Okay.
Do you advise for chewing gum?
Yes.
And is it true that it can work the same as brushing?
Not at all. Chewing gum is only a mechanism whereby you chew some rubber material. It's advisable, it's good, but not a replacement of toothbrush. So chewing gum is good because it helps keep your mouth well salivated. Anytime you chew gum, it will attract a lot of saliva into your mouth. And that is the saliva we need so that we keep washing off any bacteria that may be in excess. Chewing gum also sticks into the grooves on your teeth. And again, that manner of chewing will help unplug some of the particles that are stuck there. But it will never replace toothbrushing. So for those who love chewing gum, please let's brush first and then now we can engage in our chewing gum. Again, the debate about sugar and sugar-free and sugarless and all that, that one is not here nor there. As long as you've brushed your teeth well, whatever gum you'll chew, it will not have any damage. It may have some beneficial effects, but again, don't chew the whole day. It will tire your muscles and it will wear off your teeth.
Okay.
Because of abrasion. Yes.
Let's move to now bad breath.
Yeah.
Some people chew gum because they say it gets rid of the bad breath. So what causes the bad breath and how should someone deal with that?
We have two categories of bad breath. The first category is called, bad breath is called halitosis by name, by medical terms. So we have pathologic halitosis, which means it's a disease causing the bad breath. And the only disease in your mouth that causes bad breath is the gum disease. Then gum disease will only be caused by accumulation of plaque and tartar and what have you, and your gum swells, it has pus, and all that comes over a long time, a period of time. Yeah? And that can be solved just by visiting your dentist and having your teeth clean. Then you don't have to chew gum and use mouthwashes. We'll just remove all the deposits causing your gum to swell and your bad breath is gone. The second category of bad breath is called psychologic halitosis. That one is a headache for us because psychologic basically means your mind tells you that you have bad breath. And then you think you have bad breath, and then you act like you have bad breath. You look at everyone, whenever you are seated, someone just fidgets and pinches their nose, and you think it's bad breath. So it's a headache for us because it's usually not a disease. It's not there. But for the people it affects, they really go through a lot. They might even not trust me when I tell them, your mouth is good, I've cleaned you, you don't have bad breath. They end up, I keep telling my patients, you might end up walking the whole country looking for someone to solve it, and you'll never get a solution. But again, it's only a professional dental surgeon who can assure you that you don't have pathologic, you have psychologic halitosis.
Okay.
Yes.
Wow, that's interesting. I didn't know that sometimes it could be, you just thinking about it.
Yes.
Daktari, let's progress to now tooth crowding.
Yes.
What causes it, and is the solution for it always braces?
Okay. Crowding is a condition we see. It's getting more and more prevalent nowadays. I think we have some genetic makeover in the human race, whereby you find that the teeth we have are getting more larger than the jaws we have. So that is basically what causes crowding. Your teeth need more space than what your jaw is providing. So what mostly happens is that some teeth will grow well, but then the latecomers will find no space. And most of the culprit for that is usually what we call the canine. The canine is the third tooth from the center, the sharp one. And they are usually 4, 1 on each side. Left, right, up and down. So crowding will come in mostly because of genetic factors. So people should not be so worried about it. If your lineage takes up a crowding gene, your children and yourself may be at risk of their teeth growing in a crowded way. The other cause of crowding is premature extraction or removal of baby teeth. And that's why I discourage people from rushing to let their children get their teeth extracted for no reason. Or just because my child is 5 years, I want their teeth removed. Why? Because they should be out. No. We always advise for parents to wait for the natural tooth to come in, naturally remove the baby tooth. That is how it should be. Yeah, the baby tooth has a push that comes and destabilizes the baby tooth and it shakes. Okay, sorry, I said the permanent tooth.
Yes.
It has a push that will destabilize the baby tooth and it will fall off. So let's avoid running to pluck off the teeth, because what you end up doing is that once you remove a baby tooth quite early, you leave a lot of room there for the other teeth to move. And they were not supposed to move. If you left that tooth there, each tooth was supposed to hold its ground until it is removed naturally. When you remove it early, all teeth will fall into that space because there is additional room. So what happens? Your jaw will even tend to be smaller because it's no longer now holding as many teeth as it was supposed to. And by the time now the right number of teeth come in, they have nowhere to erupt. and you end up with crowding. Solution to crowding, visit a professional. Let's avoid going back doors, because we see so many things happening in the wrong way. People are getting the wrong treatment, and fixing braces is a specialty in dentistry, and it's only done by a few people who understand. It is mathematical in nature, because we have to calculate what spaces we need, how much space those teeth are occupying, how many teeth we need to probably remove for us to align. In most cases, you find that you may not even need to remove any tooth for your teeth to be aligned. But people will walk around telling you, I've lost 4 teeth already. I was told I need braces, so I removed 4. Now I have a huge gap here. My teeth are not straightening, because the mathematics part was not brought in.
Okay.
Yes.
All right. And how often should someone visit, a dentist for an oral exam?
Every 6 months. At most every once a year. If your oral hygiene is good, we can push it to once a year. If your oral hygiene is bad, those people who are at risk of gum disease, those tartar deposits forming, because there are people, as I told you, this is a cycle. The plaque and the tartar is a cat and mouse game. You have to keep running around and make sure you're not caught up by the gum disease. And you make sure you're not caught up by 1, brushing well, 2, visiting a dentist. Why? Because anytime you visit us, we'll advise you to have some cleaning. There's something we call scaling and polishing. And while we are at that, it's worth mentioning that that procedure is painless. Because people fear it. Some have gone through it in the bad way, in the wrong hands, and they end up with a lot of pain, a lot of sensitivity, because whoever did it did not know how to do it. When it's done professionally by someone who knows, you'll have your teeth cleaned, you'll go home, you'll take your juice, you'll take your sugar, and you won't feel a thing. So let's get into the habit of having our teeth cleaned, because that is the only surest way that we have removed most of the plaque and the tartar. And then we wait for a new layer to form again for another 6 months or 1 year, and then come and remove again. So people should not tire. People tire and think, doctor, he just wants me to go back for cleaning. But after 20 years, when your teeth start shaking, I cannot do much now. I'll only ask you, where have you been? And then the answer is, I didn't think it was that serious. So let's not wait for that point. Let's keep doing it until you are even confident, like, wow, I love it, and I can smile. And so someone is watching and perhaps wondering, where do I find Dr. All right. We have our clinic along Jogoo Road. Our clinic is Shine Dental Clinic. It's situated at Jogoo Road Plaza. Our Facebook page is Shine Dental Clinic. We are registered with the board. You can search us on Google Map.
Thank you very much, Dr. for debunking some of the myths that we had today. It has been a pleasure having you here on set today.
Thank you, Sheila.
Okay, and I hope that you back there at home do also keep in mind some of the things that Dr. has said, and of course visit a professional every time that you have a query on matters dental health. From me, it's goodbye and good night, and thank you for staying with TV47 and of course Body Garage. Goodbye.